first. The first thing I'm going to look at is bringing shoulders up towards your ears, and then you're going to be pressing them down as far as you can go. So then what we're looking at on this side is, so go ahead and relax. You want to make sure your patient's nice and tall, kind of find inferior angle of scapula. So this is where I'm starting. Go ahead and lift your shoulders up towards your ears as far as you can. So now, where's inferior angle? That distance, right? So now go ahead and bring your scapula down as far as you can, or shoulders down as far as you can. You shouldn't go down too much more. So the distance I would be measuring is from here to here. And anyone know what that distance should be?
10 to 12 centimeters.
About 10 to 12 centimeters. So I'd want to measure that on each side. So that would be, so when we say 10 to 12 centimeters for elevation and depression, it's not 10 centimeters up, 10 centimeters down from neutral. It's that entire range is 10 to 12 from the height of elevation to the bottom of depression. It should be 10 to 12 centimeters. Make sense? Yeah. Okay. So next one, we'll start with adduction. So for adduction, you're going to be bringing your scapula back that way. And then for the next one, we're going to have you bring your arms here, and you're going to come forward as far as you can. So go ahead and squeeze your shoulders back. So I want to know kind of where vertebral angle is of the vertebral border, excuse me. So from here, go ahead and bring your arms up to 90 degrees or level, and now go forward as far as you can. So that distance to vertebral border here is my full range here. Is she symmetrical? I question whether she's symmetrical. Go ahead and relax down. So then I'd measure that distance. What's that distance supposed to be? 15 centimeters. Yeah? So the next one, I want to look at upward and downward rotation. So we can either have the patient bring your arms, both of them, up overhead as far as you can, or we can go out to the side and up as far as you can. The amount of motion should be about 60 degrees up with either one, whether they go forward or to the side. So same thing here. I'm finding inferior angle. Go ahead and bring your arms forward, up over your head as far as you can go. Good. And so inferior angle, move to there. And then go ahead and bring your arms back down. And then I'm just looking, did they come back down? So that's upward rotation. Downward rotation, I want you to reach back and across as far as you can. So go ahead and reach one. We'll do this one back and across. So we started here, and then see it came to here. Yeah? And relax. So mainly what we're doing here in most clinics, you're not actually going to be writing down measurements. You're just comparing bilaterally to see if movement on the injured side is the same as the other side. What typically happens if you think about a patient who just had surgery who's in a sling, they're not able to move this arm. Well, as a result of being in the sling, they're not moving the scapula either. So the scapular muscles will start to get tight, and then here we come in, we want to measure motion. Well, if scapula is not moving, but we saw for flexion, what has to happen? That scapula has to elevate and upwardly rotate. So I need to make sure that that's actually working. So it's better if you can look at these first, make sure they're present, make sure they're moving, before you actually go into measuring range of motion. So you'd want to comment on what's tight or not moving. And then if it's tight, we would go into passive range of motion. So if you could lie down on this side, please.
On my side? Or?
Yes, on your side. And then you're going to come forward towards me. There you go.
Shall I get your shoulder dislocated? My shoulder dislocated. Maybe she might want to know that.
So first, it won't affect scapular mobility. Okay?
Yeah.
We might not use her when we measure other things later. So usually, if I'm doing passive motion of scapula, it's because something's wrong with the shoulder. So you don't want to just be here moving things, because they're going to feel like they have to guard and protect their arm. So you're actually going to come in under their arm, and that way you let the weight of their arm just completely relax on top of you. So basically, whatever I'm doing here, her arm's just going for the ride, and I'm actually supporting it. And that way she doesn't feel like her shoulder's moving. So the inferior hand is going to be on inferior angle of scapula, so I have that tucked in. And then I'm kind of up here on acromion process, spine of scap, and on clavicle a little bit. So it's kind of just a nice broad grip. So what we're doing here, elevation, depression. So right there I can already start to assess how much movement I have. What you don't want is you're just here like the robot, right? You want to actually move with it to protect yourself. And then when we go to do adduction, abduction, so now I'm rolling it forward towards me, and I'm bringing it back. And I'm taking her arm for the ride the whole time. Shoulder isn't actually changing position. Okay? Upward rotation is probably the next most challenging one. Here, you're actually rotating it. So this guy's kind of going up and down, where this guy's coming up and out. Yeah?
What are we feeling for? Yeah. I know it differs from patient to patient.
If it moves or not.
Okay.
So what you might want to have your patient do, so go ahead and tighten your muscles and don't let me move you. So now when I try to move, relax. It's not going anywhere. Versus, this is nice and this kind of glides. And some of you, as your partner does this to you, you'll be like, oh, that kind of feels good. It's kind of stretching things that I didn't know needed to be stretched. And where patients a lot of times are really tight is this upward rotation. Yeah. So then you can kind of feel and assess what's tight there. Yes? Questions? Okay. So assess in sitting, active range of motion for all 6 motions. And then take them down into side lying and try to move passively. And then switch places. Yes? All right.